Hey there, are you looking for a knee brace? Are you overwhelmed by all the options that you found when you're shopping online or shopping at the store for a knee brace? Are you unsure of which one is the best option for your particular knee situation? If that's you, that's completely normal. Everybody that's looking to get a knee brace always has these questions. I'm going to share with you 4 expert tips to help you find the right knee brace. My name is Dr. David Midoff. I'm a manual physical therapist, and I'm the owner of Paso Manual Physical Therapy. We specialize in helping people stay healthy, active, and mobile while avoiding unnecessary surgery, medications, and having to rely on injections. I'm really sorry about your knee problem, but I hope that through this video, I can give you guidance so that you can find some relief. Whether you've been shopping online for a knee brace recently, or you already own a knee brace, or this is the first time you've looked and you came across this video, these 4 tips will be helpful for you. Let's get into the 4 tips. Tip number 1, try at least 2 to 3 knee braces. It's rare that the first knee brace you try is going to be the best one for you. There's all kinds of different varieties, and without getting expert help, it's difficult knowing which one is best for you. I've got a knee brace here that we sometimes recommend to clients. Now, this is a very sturdy knee brace. This one's got straps on it. It's got metal brackets within the material here that hinge at the joint of the knee, and it doesn't really bend much sideways. This one is built for stability, and this one's pretty solid. It definitely helps people get some relief, but this might be too much for your knee problem as well. There's options out there where you can just get a neoprene sleeve, or there's different materials. Neoprene is one of those. You can get a sleeve that doesn't have any of the straps, no brackets, and they're much more basic. They may still have the hole here for the kneecap to set in, and that might be enough for you. But I encourage you, try different options out there. Keep your receipt for the knee brace just in case you decide that it's not helpful for you, so that you can take it back to the store. Tip number 2. Plan on being uncomfortable. There's no such thing as a comfortable knee brace. Everybody that I've guided on starting to wear a knee brace, I've always had to tell them, you gotta watch out for these knee braces. They slide down your leg. You have to constantly pull it up. Everybody's legs are different shapes, and knee braces are not really one size fits all, even though some of the packaging might say that. You got to find a way to make sure that it stays in place as best as possible, but be okay with just having to constantly adjust it. Some people wear it over their clothing. Some people put it right on their skin. I encourage putting it on the skin just because it'll stay in place better. But you're going to have to deal with sweat buildup in there and associated odors. Keep that knee brace nice and clean so that you can avoid getting any sort of rash or infection on your skin. This is part of having a knee brace. You've just got to maintain it as you look to get better and find that relief for your knee. Tip number 3, you get what you pay for with knee braces. Generally, you can spend anywhere from $10, maybe even less, all the way up into the multiple hundreds for knee braces. And a cheaper brace might actually be just what you need. It might be effective in giving you the relief that you're looking for than an expensive brace. But what you're really looking at in the difference is the quality of the materials, the quality of the components in there. Generally speaking, a more high-end knee brace, the materials last longer. The seams stay together better, the materials don't rip, and the other harder components don't break as easy. So you have to factor in how active are you going to be, how much you're going to be on your feet, how much stability do you need, the shape of your leg, all those other things I talked about when choosing whether or not to buy a lower end knee brace or a higher end knee brace. Tip number 4, have a plan to get off that knee brace. Now, it's not a good idea to wear a knee brace indefinitely. You need to make sure that there comes a point where you're eventually going to get out of that knee brace and get back to normal. If you've been dealing with a knee problem for a long time, in 9 out of 10 cases that we see here in the clinic, it doesn't work out where the knee brace alone can fix the problem. There's usually a combination of other treatments that need to happen in addition to wearing the knee brace to solve a long-term chronic knee problem. The type of knee problem that's been going on for months, years, or even decades, there's a long process to make sure that that knee problem gets to the point where it's normal again, or as close to normal as it's going to get, so that you can avoid having a surgery or having to rely on injections or pain medications that are not healthy for you in the long term. There's many reasons why knees begin to hurt. There's lots of structures inside the knees: joints, cartilage, bones, muscles, tendons, ligaments, nerves. And any one of these structures or combination of these structures might be contributing to your knee problem. And so without checking your knee problem in person by hand and seeing how you move, it's not really possible to give you a schedule on how often to wear your knee brace each day, how long to wear it, when it's okay to have it off, when you absolutely need to have it on, and then when to begin to wean out of the knee brace so that you can get back to normal. Those details need to be discussed with a specialist like ourselves here so that you can make sure you get your knee back to normal. If you're looking to learn more about how we help people with knee problems, I encourage you to visit our website at epmanualphysicaltherapy.com. We've got tons of blogs on knee problems and other free helpful information that you can use to get help for your knee problem. I wish you the best of luck in getting relief for your knee. Bye-bye.